Do you want to know whether you have chest fat or gynecomastia? What's the difference between the two and what are the treatment options available? My name is Omar Tilwa. I'm a plastic surgeon specialized in body contouring surgery and the medical director of Cryo Clinic. In these short videos, I'm going to answer the most common questions about chest fat tissue and gynecomastia. So what is gynecomastia? Gynecomastia is an abnormal growth of the breast tissue in a male chest. It can be small, mild, moderate, or severe, which can be protruding and can be obvious under the clothes. So gynecomastia or chest fat, how can you tell the difference? So chest fat meaning excessive fat tissue on the chest wall. However, gynecomastia is an abnormal growth of the gland, which is the breast tissue on the chest. You can tell you notice that if you lose the weight, you can lose the chest fat. However, the gynecomastia doesn't shift, so it will be persistent even when you lose your weight to the maximum. And how can I tell when I examine you? The fat tissue will often feel soft, and it will be usually uniform and all over the body most often. The gynecomastia tends to be glandular, localized, and well-defined within the chest. Symptoms of gynecomastia. There are several symptoms which can be linked to gynecomastia. So you may notice an increase in the volume of the chest, could be on one side or on both sides. You may notice or experience tenderness in the area, so painful on touch, or it could be an ongoing discomfort or pain. Very rarely, some people can describe a milky discharge from the nipples area. So causes of gynecomastia, there are several causes. The most common cause is physiological. That means with our growth and changes in our physiology, some people develop gynecomastia, and those related to hormone changes in puberty or in old ages. Secondly, it can be pharmacological, so that means there are certain medications which can cause the gynecomastia. And the most common cause actually, there's no direct cause. We call it idiopathic. It just kind of, it just happens with no direct cause. Now, most gynecomastia tends to resolve spontaneously with time. However, if there is underlying cause or if it doesn't resolve with time, then surgery might become necessary. So what are the treatment options for gynecomastia and chest fat? So I'm going to talk about the surgical options to treat gynecomastia and chest fat. The first option is the liposuction, which helps to remove the chest fat and can reduce the volume of the protrusion or reduce the amount of gynecomastia. Secondly is what we do with the gland tissue. So if there is excessive gland tissue, then the way to get rid of it is to do an open excision, making a small cut and remove the gland. And third thing to address or to look for is what do we do with skin. If there is big gynecomastia and a lot of skin, then we have to look into options to tighten the skin, such as surgical excision or energy devices such as Renuvion or Body Tight.